Dear students, welcome back. In the previous session, we have discussed about femoral sheath. Now we are going to discuss about femoral canal. This is the medial compartment of the femoral sheath. As we know that in the previous session, this is the femoral sheath, isn't it? Yes. Okay, this is the femoral sheath. So this femoral sheath is divided into three compartments. So one is lateral, middle or intermediate or medial compartment. So this medial compartment of the femoral sheath is called as femoral canal. Okay, normally this femoral canal is associated with lymph nodes. Okay, lymphatics and lymph node of clockwork. Okay, so in the intermediate compartment of the femoral sheath will have femoral vein, and the lateral will have a femoral artery along with the femoral branch of genitofemoral nerve. Okay, now we are mainly concerned about this medial compartment of the femoral sheath, that is called as femoral canal. So here you can see in different schematic representation. This one is the femoral canal. Okay, so this femoral canal is conical in shape. So this one is conical in shape. Okay, the femoral canal is conical in shape, being wider above. So here above at the base and narrow below. Above it is wider and below it is narrower. It is about 1.5 centimeters long and 1.5 centimeters wide at the base. So the length is 1.5 centimeters and the width at the upper part, that is at the base, is also 1.5 centimeters. Okay, the base or upper end of the femoral canal is called as femoral ring. So this part is called as femoral ring. The femoral canal, the upper or base of the femoral canal is called as femoral ring. If you see the boundaries of the femoral ring, so boundaries of the femoral ring are important. Okay, so it is bounded anteriorly by the inguinal ligament. So if you can see here in this, of course this one is an applied anatomy, but anteriorly the femoral canal is related with the inguinal ligament. Posteriorly, so as we know that the floor of the femoral triangle, which is formed by medially by the pectineus and adductor longus, but posteriorly to the femoral canal, so this part is related to the pectineus muscle and its fascia, and medially, so on the medial side, it is related to the lacunar ligament, that is concave margin of lacunar ligament, and laterally it is related to the septum. Okay, so laterally this one, it is dividing the femoral sheath is divided into compartment, isn't it? So on the lateral aspect you can see the septum, which is dividing the intermediate and the medial compartment. So these are the boundaries of the femoral ring, not the femoral canal, only for the femoral ring, that is the opening of the femoral canal, that is the base of the femoral canal, which is related to the base of the femoral canal is related to anteriorly by the inguinal ligament, posteriorly by the pectineus muscle and its covering fascia, medially by the concave margin of the lacunar ligament, and laterally by the septum separating it from the femoral vein. These are the boundaries of the femoral ring. Femoral ring is the opening of the femoral canal or the base of the femoral canal. Okay. Next, the inferior epigastric vessels are closely related to the junction of anterior and lateral walls of the ring. The femoral ring is closed by a condensation of extraperitoneal connective tissue called the femoral septum. The parietal peritoneum covering septum from above shows a depression called femoral fossa. The parietal peritoneum covering septum from above shows a depression called as femoral fossa. So what are the contents? So as we know that it mainly contains lymphatics or lymph node of Cloquet. It is also called as Rosenmuller. Lymphatics and a small amount of, along with this small amount of areolar tissue also present. This lymph node, I have already mentioned, these drains the glans penis in males and clitoris in females. So this is about the femoral canal. Now if you see the clinical anatomy of this femoral canal, it mainly associated with the femoral hernia. So femoral hernia. So the femoral canal is an area of potential weakness in the abdominal wall through which abdominal contents may bulge out from forming a femoral hernia. A femoral hernia is more common in females because the femoral canal is wider in females than in males. Okay, this is associated with wider pelvis and the smaller size of the femoral vessels in the females. So if you see the contents, hernia is comprises a neck and a sac. So this is the neck and a sac. Coverings or the various layers, what we have seen in abdomen, the same thing, the various layers on the sac. Mostly the content of the hernial sac is a loop of bowel, that means intestine. So a loop of intestine may be herniated through this femoral canal. Okay, so this is all about the femoral canal. In the next session, we are going to discuss about the muscles of the anterior compartment of the thigh, its origin, insertion, action and nerve supply. Thank you.